Hello everyone, I'm Millie Swan, and today I'm joined by Dr. Steve Farrell, who's our Chief Medical Officer here at Forrest General, and we're going to give you an update today about the COVID vaccine. So Dr. Farrell, we really seem like we've come a long way. It's been a hard year for everyone, but good news on the horizon. We rolled out the vaccine yesterday here at Forrest General, so you want to tell us a little bit about that?
Yes, Millie, we're very excited. It has been a long time coming. We received our first doses of the Pfizer vaccine after a long time of preparation. We received it on Monday, the 14th. We were able to store it in our newly acquired freezer, which was specially bought for that purpose. We had a work team that had been doing a lot of work in planning the administration of the vaccine, and they were able to start yesterday in a soft opening and administering the vaccine, and now we're going full speed ahead.
Okay, well, you know that a lot of people in the public have a lot of anxiety on whether or not they should make the decision to take the vaccine. So I think you took the vaccine yesterday, so do you want to tell people how are you feeling today and what are the results you've heard, and kind of give them a little peace of mind if they decide to take the vaccine?
I think it's natural for people to be fearful of anything that's new, and we have studied it ourselves before we decided to take it. I decided to take it, and there's been a lot of information that's been disseminated. It's really incredible science that they were able to develop a vaccine of this nature as quickly as they did, not just in one company, but more than one company with similar techniques. And so we know that we have a very effective vaccine, and we also believe it to be very, very safe. I took the vaccine yesterday morning, and I had a very slight sore arm today, didn't have any effects yesterday, and a very slight headache this morning when I woke up. Two of the reported side effects of getting the vaccine. And there is a long list of reported side effects as with any vaccination. And we've looked long and hard at that. My decision to get the vaccine was based on my belief that 24 to 36 hours of side effects and symptoms, which might make me feel bad, is better than 2 weeks to 3 months of a COVID-19 illness, which might put me in the hospital or even take my life.
Right. And there's a lot of information out there, and we encourage people to go and become educated and read about the side effects and do the comparisons and make an educated decision for sure. Well, I know that one question we've been asked a lot since we did get the vaccine here for our staff, that was really dictated by the CDC as far as the different cohorts and the order of those that would be getting the vaccine first. So can you tell us a little bit about that?
Yes, the government's providing the vaccine at no cost. It costs us nothing, it costs the patients nothing. So as a result of their provision of the vaccine, they've gotten to say who gets it first. And we've had to adhere to their guidelines, and their guidelines are very scientific. They want us to administer it first to the care providers who provide direct patient care in any form or fashion to all of our COVID patients. So that's the first line of recipients, as well as those patients who are highest risk, which include mostly patients in long-term care facilities or skilled nursing units.
Well, tell us where the public you think will be able to get it and when. Do you have any update on that?
I don't have any recent update on when the vaccine will be available to the general public. If we look at how fast it's been rolled out to hospitals, we believe most of the larger hospitals and healthcare facilities have received the Pfizer vaccine getting started on Monday. The Moderna vaccine is likely to become available next week. That's slated to go out to many of the smaller hospitals and even to some medical clinics. The first people to receive it in those clinics and smaller hospitals, again, will be the care providers who are going to take care of the people with COVID-19 illness. Eventually, the government will make it available to be administered to the general public. I hope that would be in the next 1 to 2 months. I don't have anything to tell me when it might be.
Well, and we do want to make it clear that right now, of course, people can't come to the hospital to get the vaccine. We are just doing it for our employees that are frontline and our physicians, and of course we'll definitely share information as we're updated when it becomes available through clinics or maybe even through local pharmacies or the way that people, usually get like their flu shot. And speaking of the flu shot, I know a lot of people say, is this the same as getting a flu shot and you could have different, strains of the flu? Is it the same thing with, COVID, that even if you got the vaccine, you could still get COVID?
What we know so far, the corona SARS-CoV-2 virus is not the same as an influenza virus. There are several different strains of influenza virus and different types of influenza viruses, and that's why some years the flu virus is successful, the flu virus vaccine is successful, and some years it's not, because that's always a prediction of what the CDC believes the next year's flu burden will be. So they predict what flu strain will be evident in the next year, and then they produce a vaccine for that. This is one virus. There are not different strains of the viruses. We have seen in some instances in the science that there's some different mutations and modifications in the virus that may allow people to get a second infection after they've already had it. So we believe that getting a vaccine now will protect people against the COVID illness or the corona SARS-CoV-2 virus, and that they may have to have it repeated, in the next year, 18 months, as we see that the immunity wears off.
Do you think, just like the cohorts that came out as far as the order for, providers and the caregivers, do you think that also it will be rolled out those that qualify to receive the vaccine first because of underlying conditions, because we've heard that, COVID can be a little bit harder on those who have those underlying conditions?
I think when we have enough to administer it to the general population, that we will make it available to anyone who wants to line it up and take a shot. I believe we would emphasize to those people who have conditions such as diabetes, heart failure, lung disease, underlying immune conditions, chronic health conditions, the elderly, that those people should in fact be strongly encouraged to take the vaccine as soon as it's available, rather than waiting to see what the effects of the vaccine might be on the rest of the population.
Okay. Well, to wrap us up today and to share a little bit more, the holidays are coming up, and people, of course, want to get together. They want Christmas to be like Christmas past. We've had to adapt to a new environment. So what words of wisdom do you have to share with people with the upcoming holiday?
This Christmas is not going to be like any of the past. I think it shouldn't be. I think we should restrict ourselves to very close family and very small groups. We should continue to watch our social gatherings in very small numbers, mask appropriately, maintain social distancing, and be hand washing and everything we've done over the last 9 months to prevent the continued spread of this disease. We've seen a huge rise in the cases of COVID illness since Thanksgiving. It's continuing to increase daily to record numbers across the country. And we believe that if we don't do something continually to try and stem the tide, we will see another increase following the Christmas holidays. So I would urge everyone to do everything they can to just expose themselves only to very close family members in very small numbers. And then next year, when COVID's not here, celebrate wildly.
That's right. Well, our first priority is to, keep everyone safe. And definitely here in the hospital, we have to have our employees well taken care of so they can take care of those who need us. And there's people, as we all know, way beyond COVID that need our help daily. So you're right, we've got to do that across the state. So I appreciate you being here today and giving us an update. And thank you for tuning in and for joining us. And we just say mask up, stay safe, and we do hope that you have a very Merry Christmas and a happy holiday.